Ethan is in 3rd grade. He loves PE, even though he does use a walker. His teacher is able to accommodate him in all sorts of ways. He is an honor roll student. He's silly, he's funny.
In West Virginia, roughly 50% of all kids rely on Medicaid. In southern West Virginia, that number is upwards to 70%.
We have very good private insurance, but it just doesn't pay everything. It doesn't cover everything, and it leaves huge medical bills that we would be unable to pay if it weren't for the Medicaid gapping that coverage that ensures Ethan a good quality of life.
You know, there's a real fear if your child is sick, what that could do to the family. And you want to make sure that you nip things in the bud, that you get the child access and care as soon as possible.
Research has shown that children who have Medicaid when they're growing up are more likely to graduate from high school and as a result get better jobs. So because better economic outcomes mean more payment of taxes, less use of government services as adults, this means that Medicaid is a really good return on government investment.
Cuts to Medicaid in West Virginia would be devastating. We have 97% of West Virginia's kids who are insured. We also have more school-based health centers per capita than any other state in the country. So not only are we addressing the needs of the kids to keep them insured, we're also addressing our access to care. We would lose that number of kids who are insured if we lost Medicaid, and our school-based health centers are run by federally qualified health centers and critical access hospitals. They rely on Medicaid funding, so we would lose those as well. So two of the biggest steps that we've taken to address the healthcare needs of these kids we would lose if we lost Medicaid.
Ethan currently receives a waiver. That waiver is a program that can be taken away. It's not a guarantee. If the amount of funding coming in is reduced, programs have to go away.
The problem with cutting Medicaid is that people's healthcare needs don't go away. They still have those costs and they get shifted to other payers in the system. They may wind up in the emergency room, they're sicker, and that costs more. And that gets shifted to folks' employer-sponsored coverage. It can become bad debt for the hospital. It's not a Medicaid problem, this is a healthcare problem.
Now is not the time to take it away. Now is the time to dig in and ensure that these kids have an opportunity to thrive.
I'm not asking for you to sacrifice your child for mine. I'm not asking you to sacrifice your family for mine. What I'm asking is that we can all come together and sit down and discuss and craft a policy that would be good for all of us.